I'm Brienne Cryer. I'm your OT today. How are you?
I'm doing good. How are you?
Good, good. Okay, we're going to look at your shoulder to see if you have any problems. So first we're going to look at it, and then I'm going to feel it, and then I'm going to move it.
Okay.
Okay? So first, I'm going to be looking for any swelling here at the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint. Okay, I'll be comparing it to the other side because once swollen, the GH joint swells anteriorly. Okay, and now I'll look for any muscle atrophy of the deltoid, and then also the infraspinatus, the supraspinatus, and the teres minor here. Okay. If atrophy of the deltoid is noticed, there will be more of a squared shoulder rather than a curved shoulder. It's important to look for any misalignment of the shoulders by comparing both sides, and also to look for any winging of the scapula. Okay, now we're going to feel. We will begin with the medial aspect and work our way laterally. We will begin by palpating the sternum towards the sternoclavicular joint. We are feeling for any tenderness. Follow the medial convex area of the clavicle toward the lateral concave aspect of the clavicle until we find the AC joint, where we will also feel for tenderness. Also, below the lateral aspect of the clavicle, we will find the coracoid process and check for any tenderness. Lateral to that, we will find the GH joint line, which we will check for tenderness. Going back up the acromion, we will work our way to the lateral aspect. Below the acromion, there will be a subacromial bursa. This is best palpated when the shoulder is extended because the bursa is moved anteriorly. Posterior to that, you will find the subdeltoid bursa. Back on the acromion toward the humerus, if the shoulder is externally rotated, you will find the bicipital tendon, which is located in the bicipital groove. We will now palpate down the humerus and then onto the spine of the scapula. We are checking for any tenderness of the supraspinatus, infraspinatus, teres minor, and trapezius. When conducting the shoulder examination, it's important not to forget the axilla. We will check the medial and lateral portion of the humeral heads behind the pectoral muscle for lymph nodes, and the posterior aspect for lymph nodes. Thank you. Now we're going to see your shoulder move. We will conduct a formal active range of motion test. We are looking for the smoothness and extent of the movement. Okay, Ms. Mrazek, can you abduct your arms to the sky for me? Bring your arms behind your head and push your elbows back. Bring your arms back above your head and turn your palms out. Drop your arms down to the side slowly. With your left arm, touch your right shoulder. Go ahead and relax. With your right arm, touch your left shoulder. And relax. Can you flex your shoulders up above your head in front of you? Bring them down Now bring your arms behind you as high as you can. Now can you turn around and bring your hand up as high as you can as if you're scratching your back. Okay, now do your other arm. Okay, do a push-up on the wall. At this time, we are looking for any winging of the scapula here. Okay, you can come back to me. If winging is noticed, it may be secondary to lateral scapular nerve damage. We're going to check internal and external rotation. Place your elbows at a 90-degree angle like this, and can you externally rotate them and bring them outwards? Now go ahead and bring them inward toward the body as if you were giving yourself a hug. Okay, relax, and thank you, we're done. Okay, next we're going to do 3 different examinations to test for impingement. The first test, we will hold the acromion down and passively abduct the patient's arm. Do you feel any pain? No. Good? Okay, the second test is the Neers test. We will flex the shoulder and internally rotate. Do you feel any pain? No. Good. The last test is the Hawkins test. We will flex the shoulder to 90, flex the elbow, adduct, and internally rotate. Do you feel any pain? No. Okay, good. Okay, next we're going to do a couple formal tests to examine the rotator cuff muscles. Can I get you to flex your elbows to 90 degrees? Good. And then abduct your shoulders. Good. Okay, now hold this position and don't let me move you. Good, you can relax. Okay, now can I get you to bring your arms out in front of you like this? The next test is called the empty can test. You're going to pretend like you're emptying out this bottle, like this. Okay, good. Okay, and I'm going to push you down, but don't let me move you. Good. Okay, you can relax. On the next test, can I get you to bring your arms back to here, and make sure you keep your elbows tucked into your side. Now bring your hands outwards and your arms, yeah. Okay, I'm going to push your arms, hold it there, don't let me move you. Good. Now on the next one, give yourself a hug like this. I'm going to pull your arms, don't let me move you. Good. Okay, can you turn around and face the back wall for me? Good. Now bring your hand behind your back as if you're tucking in your shirt. Good. Just bring your hands out like this and don't touch your back. Okay, I'm gonna push, so don't let me move you. The next test is called the Jurgensen's test. Can you put your arms in this position with your palms facing up? Okay, I'm going to try to turn your arm over. Don't let me move you. Good. Okay, and now can you put your arms out in front of you with your palms up? And hold them there. Don't let me push you down. Good, you can relax. Now we're going to examine your acromioclavicular joint. I want you to reach across your chest to your opposite shoulder, like this. Okay, and I'm gonna push you. Does that hurt? No. Okay. And can you reach behind your back and I'm going to apply some pressure. Any pain?
No.
Good. Now we're going to go through glenohumeral joint stability test, and I'm going to check your anterior stability, your posterior stability, your inferior stability. Okay, and now I'm going to do an apprehension test. So just bring your arm out this way, flex your elbow, and then externally rotate. Good. You can relax. Okay, now we're going to examine your myotomes. Okay, so we're going to do a little thing to help that you can do to remember this. Okay, so first, can you put your hands in a fist and up like this? So this is like your waitress waiting at the bar for your customer. Next, your customers order a drink, and you're gonna bring the tray to them. Good. Okay. Now, you're gonna go ask for a tip. So you're gonna bring your arm down like this. Good, and straighten your elbow. Good. They didn't give you enough money, so you're gonna say, give me more. Okay, and they say how much, and you say $5.
$5.
Now we're gonna look at your dermatomes. Okay, so we are going to look at C5, which is found on the lateral aspect of the arm here, and C6, which begins at the tip of the thumb, and C7, which begins with the long finger, and C8, which begins with the pinky, and then finally T1, which can be found on the medial aspect of the arm. And we're done. Thank you.
Thank you.